All right, welcome everybody. It's a brand new era in Health Talk. I'm Peter Christian. John King is over there. Good morning, John.
Good morning, Peter.
And in studio with us this morning, Dr. Dean French, the CEO of a community medical center. I keep wanting to say Dr. Dean because that brings back memories to me, but Dr. French, welcome. Welcome to the show.
Thank you, Peter.
And thank you for agreeing to sponsor Health Talk. This is very exciting for us. We are thrilled to have you aboard.
We're excited to be on board, and I'm excited to be here for our first edition.
Okay. Now, there may be folks out there who remember you as their family doctor from Plains, right?
And Thompson Falls and Knoxon and Heron.
Wow. All right. Good for you. So tell us a little bit about how you came to Montana.
Well, I was in the military. I was in the Army Special Forces, and during my time in the military, I became a what's known as a Special Forces medic. And that led me to decide to pursue a career in medicine. And I actually got out of the military with a goal of being a rural family physician because I was kind of a rural family physician without a license when I was in the Army. And so I went to the University of Washington, which is renowned for good reason for training rural docs. And when I finished my residency program down, I came back and found a job in Plains. I'd actually found Plains while I was doing a medicine rotation in Spokane, an OBGYN rotation in Spokane. I went driving up to Sandpoint, Idaho, and down Highway 200 and found the beautiful Clark Fork River Valley and discovered that part of the world and decided when I finished my residency that's where I wanted to practice.
This is it.
That's it.
This is it.
Yeah.
Wow. So now that you're here and you are the CEO of Community Medical Center, I understand there's kind of a new concept called a physician-led model, and that's one of the things that really helps because you are a physician. So tell me how that works with community.
Sure. A physician-led model is not actually a new model. Some of the larger hospitals in the country that are well known, like the Mayo Clinic, like the Cleveland Clinic, have been physician-led since their inception. And I think their success at driving high-quality healthcare and really being models for great healthcare systems in the country has led others to evaluate, does a physician-led model make some sense? Billings Clinic, which was involved in the acquisition of Community Medical Center last year in partnership with Regional Healthcare Partners, is a physician-led model, and they've based their model on the Mayo Clinic model. And so it was important with their acquisition of CMC that they stand up that model here.
What do you think are the benefits of the model?
Well, I think when you have physicians leading a healthcare system, you have people that intimately understand the clinical care of patients with a voice at the table and thinking about how we should best deliver that care, which is different than a kind of standard business MBA model.
So, but basically, rather than the doctors being underneath this corporate, structure, having to toe the corporate line, there's an actual doctor at the top you can go talk with, and he understands the various intricacies of being a healthcare provider, in addition to running a hospital.
Correct, and it's more layered than that. I mean, we've had a very intentional effort this year to build throughout the hospital physician-led model. So we create what's called a dyad, where we pair a physician leader with a more administrative, standard kind of classic administrative lead throughout the hospital. So our Women and Children's Service line right now has a dyad with Dr. Bardette Fawcett partnered with a nurse administrator. We've done the same thing with our surgery department. And we're going to continue that through. So it's not just the CEO as a physician, but we're really embedding that physician leadership throughout the whole hospital.
What do you think that does for the patient?
Well, the goal is to make sure that we're actually providing the services that the patients need, and that the way that we're providing them is, I guess, doctor approved is the way I would put it. What we know in those models is that the quality of the product improves, that the outcomes improve. So the interesting thing there is CMC, Community Medical Center, has a really strong record already in that regard. Right now in the state of Montana, there is no one in the state that has the same quality outcomes as Community Medical Center. We're actually leading right now. One of the big challenges in medicine is trying to prevent patients from being harmed while they're in a hospital. It's one of the challenges that's a little bit under the radar sometimes is a lot of patients get harmed when they come in the hospital. Hospitals are dangerous places. Community Medical Center right now has the best safety record in the state of Montana.
So
we're very proud of it.
When the CEO talks about outcomes, you're not talking about financial outcomes. You're talking about health outcomes for the patients.
Correct, John. That's exactly what I'm talking about. I don't even think, I probably shouldn't say this out loud. I don't even think about the financial outcomes. When I think outcomes,
because you're a doctor.
How are the patients doing? Correct.
Well, let's talk for a second because, as you had mentioned, Billings Clinic, Regional Healthcare Partners took over Community Medical Center a year or so ago, and a lot of people are still confused as to how all that worked. I mean, it was a not-for-profit, and now it's a for-profit. So if you could kind of flesh that out and explain just exactly what that means.
Sure, and I'll just give you one person's opinion.
Okay.
Mine.
Okay.
The reality is it's one of the least understood things in medicine. Not-for-profit versus for-profit in terms of the way I think, there's really very little difference. It's really a matter of how you access capital to build things and expand your facilities. If I'm in a not-for-profit model, which I spent a large portion of my career in, you have to maintain your bond rating, which means you have to have good financial metrics. You have to have a strong margin to keep your bond rating up, and your bond rating is how you access the capital market so you can build a new hospital or build a new building. The for-profit model is almost identical. It's just a different financial instrument. We have to impress our investors so they invest and put more capital into us. In the case of Regional Care is a privately held company. There are no stocks right now in Regional Care. It is financed by private equity. And its goal is to build its portfolio of hospitals and build them in a way that shows quality outcomes. And again, I'm not talking about financials. I'm talking about showing that from a value-based standpoint, the hospitals in the Regional Care portfolio are some of the strongest performers in the country from a standpoint of safety, patient experience, and cost. And by doing that, that raises the value of Regional Care Hospital Partners. And at some point, then Regional Care is able to go public and make an initial public offering. That's what finances our capital. One
of the things that I think people need to know is a community medical center, you're paying property taxes, right? About $1 million a year right now in local property taxes is what we're paying. And if we were in the not-for-profit model, we would not be paying any property taxes, obviously. Thank you. You're welcome. And Mayor Enkin, you're welcome also.
Oh, I'm sure he's happy about that. I'm curious what you think are some of the biggest advantages or some of the best work the community does. When you think of community as being a leader in a particular field, what fields come to mind?
Well, Community Medical Center has had an enviable position in Western Montana for a long time in leading in the field of what we call perinatal medicine. So that's that high-risk obstetrics. And in Western Montana, with as far-flung as our region is, Community has done a remarkable job of always making sure that there's a place for moms with difficulties in their pregnancy, and more importantly, when those babies are delivered, a place for those babies to be nurtured and brought into the world and not have to leave Western Montana to do that. And so we have a very robust maternal fetal medicine program, which is taking care of those high-risk moms, and a very robust neonatal intensive care unit led by neonatologists. And it's really been this sort of cornerstone of Community Medical Center for 40 years. As a family doc practicing up in Thompson Falls, this is where I sent my patients that I was struggling with and couldn't manage up there. So they've always been a safety net and a lifeline for those of us out there practicing in the more frontier areas of Western Montana. We're up against a break. If you have a question for the CEO, Dr. Dean French, give us a call, 721-1290. All three lines are open. We'll be right back with more of Health Talk in a moment. Little gentle humor there, a little Dr. My Eyes going in. Here we are in Health Talk. 721-1290 is our number, 1-800-568-5309. And we've got Bruce on the line to talk with Dr. Dean French. Bruce, you're on Talkback. I'm sorry, Health Talk. Hi.
Hi there.
What's on your mind, sir?
I've had the experience of both emergency rooms, both at St. Pat's and in community, and the differences are very, very dramatic. And I was curious whether community is going to be improving and updating their emergency room facilities.
Okay, thanks for the call.
Well, I appreciate the question, Bruce, and we are looking at our emergency room. It is small and somewhat space challenged, and so yes, we have engaged with a firm that does this across the country, and it is on the list of things that we're considering and we think we probably need to do in the near term.
Now, how does it work now with air ambulances? I know that for a while, each hospital had its own ambulance, and then there was one ambulance, and now there's some regional ambulance services. How does that work here in Missoula, especially with community?
Well, we obviously we don't have a helicopter based at community. We use the regional helicopter services, which are all private entities. Actually, the two that we use the most, one is MedStar, which is out of Spokane and is part of a not-for-profit foundation,
Mm-hmm.
and then Life Flight out of Butte, which is also based out of actually Oregon and is a not-for-profit foundation. We rely on both of those services to bring us our patients. MedStar has a neonatal team, and so when we're having to go get sick babies across the state, they come pick up our neonatal intensive care team and fly them to the baby, and then they have the ability on their helicopter to put that baby on the bird and make sure it's able to be cared for on the flight back into Missoula.
Wow.
Tell me what it means to you, especially when you came on board at Community and you saw this already extant, amazing, neonatal unit, and what a benefit it is to not just regionally but statewide. So what did that mean to you personally?
Well, I just feel humbled. I like I said, I am practicing up in planes. I can remember the team from here flying up and rescuing me in one particular case when I had a very, very complicated pregnancy arrive in our emergency room up there, and I had to do an emergency C-section in planes. And having that helicopter land from Community was, it was life-saving for the baby and the mom, but it was probably life-saving for me too. So
Wow.
for me, being the CEO of the hospital with that resource is just humbling. And that's why, yes, I'm a physician leader, but I have to rely on the other physicians in the building because there's far more talent and brain power there than what resides between my ears.
What are some of the other things you think that Community excels at? Obviously, we mentioned the neonatal ward.
It's a great question. The thing that Community I think is most remarkable is the family of people that work there. The team that they've assembled over the years is remarkable, and the camaraderie and the ethic they bring to taking care of patients. But I think the things that stand out at Community, there's a lot, but our rehabilitative services and we have the ability to take care of patients after severe injuries, stroke, spinal cord injuries, and get them back on their feet. There's just some remarkable stories, and the team that they've assembled over there is actually not. I've never encountered it in any of my other hospitals that I've been responsible for. So that's one of our prides. Our orthopedic unit, similarly, we have a dedicated unit just for orthopedic surgery, and again, the outcomes, meaning patients do really well. They have short stays. They don't come back sicker. They recover well. We get them home. And there's a long legacy at Community Medical Center, and it's the physicians that have led that.
I wanted to step back. Earlier, you had mentioned that one of the big positive outcomes you have is that people don't get sick at your hospital as frequently as they do at other hospitals, apparently. What is the reason for that? There must be some underlying procedures or something in place that keeps your numbers low when it comes to...
Everybody's in a bubble, obviously.
Right. It's not that. It's actually very intentional. I mean, there has been a laser-like focus on making sure that everything that we can do that's evidence-based, that improves patient outcomes, is in place over there. And it's little things from, making sure that they have the right antibiotic at the right time prior to going back for a surgery, making sure that our environmental services crew has been trained up to turn over a room and make sure that the pathogens in that room are destroyed before another patient comes in. It's a host of things. It's not a single thing. But the thing that I think differentiates Community is the effort that's put in around it. There is a quality improvement team that's their focus all the time, and it's embedded through the whole organization. And it's made a difference.
And so when you're talking about hospitals hurting each other, we're talking about infections and MRSA and all that stuff, right?
Correct.
The horror stories that you hear about.
Correct.
Wow.
And,
All right.
and every hospital has that stuff. We're not immune from it, but our rates right now are some of the lowest in the nation.
Now, what was it that led you folks, probably it began before you got here, but as you continue with that, what was it that led you to increase that effort?
Well, I think everyone is focused on it. But the big change is our payers. So Medicare and the commercial payers, Blue Cross Blue Shield, Allegiance, Pacific Source, all of them are looking more and more at the bottom line. If a patient gets sicker in your facility, that's going to drive up their costs. And so the big movement's been with Medicare really telling hospitals, hey, we're going to start paying you based on value, which is quality divided by cost. Right now in the state of Montana, Community Medical Center has the best value-based purchasing score from Medicare in the state. And that's patient experience, what the patients are saying about the care they receive. It's our outcomes, meaning infections, blood clots, things that happen in hospitals. And we're doing it at the lowest cost point. And that's being noticed. So on a scale of 1 to 100, we're at the top of that scale for the Montana hospitals.
Wow.
We're up against a break. We'll be right back. Again, all three lines open if you'd like to visit with Dr. Dean French, the CEO of Missoula's Community Medical Center on Health Talk. We'll be back in a moment. Okay, we're back on Health Talk, sponsored by Community Medical Center from day one. Joining us in the studio, CEO Dean French. Now, you guys are having a fascinating conversation off the air. I want to share that with our listeners.
Yeah, so paying for medical care has always flummoxed me. I don't understand it at all. But I asked him this question on the break. So the question for Dean was, with what you explained about the way that Medicare works, does my $100 worth of Medicare, does that actually get me more service for the money if I go to community than another hospital that has a lower score? And so I'll just go ahead and let you answer, Dean.
And I gave an answer that wasn't quite answering your question, so I could be running, right?
Right.
But the answer to the question is Medicare looks at what's called a cost per beneficiary. And so what it looks at is for each episode of care, whether that's pneumonia or a hip replacement, did that hospital that took care of that patient, did they spend more money? Did it cost Medicare more than another hospital? And in that arena, the answer to your question is yes, it goes further at community. And the reason why is because our rate of complications is lower and complications drive cost. And so that cost per beneficiary is driven down because of our good health outcomes.
All right, we have a question from Katie. She wants to know where community stands on online gateways and concierge care.
Wow, Katie, that's quite a question, and it's a great question. We are looking at expanding our online presence and thinking about how do we get more access for people based on their handheld device. I should be able to come into, be at work and got a sore throat and I want to get into the doctor. How do I do that on my iPhone?
Cough into your iPhone and then they'll diagnose you, or what?
So actually,
that's coming.
But we're looking at a lot of different solution sets. But the world has changed, and healthcare hasn't really changed with it, particularly in the way we leverage technology. So that is, I don't want to get too far out ahead of myself, but it is one of those areas we're focused on, and that is the concept. How can I just with my iPhone say, hey, I have a sore throat, I want to see somebody, and I push a button and I'm given, here's 6 options, which one do you want? I pick one and I'm in.
Wow. And what about the other issue, concierge care?
Well, concierge care, I think we already do in a variety of areas. I think that the area we're strongest in is our cancer center. We have what's called navigators built into our cancer center. So if you get referred in by your primary care doc to one of our cancer specialists, there's going to be somebody at your side all the way through making sure that your needs are met. And that can be anything from housing to social needs to making sure if you've lost your hair that we get a wig that fits you that you're happy with. It's taking care of everything. And we have those folks embedded in your care all the way through.
All right. Now, when I go walking around Fort Missoula, I see the cancer center in the back there, and that gorgeous area where you have people come out. There's reflection. There's benches, and you put a lot of thought into that building, right?
Well, I didn't because I wasn't here.
Well, you know what I
mean. My team did,
Yeah.
and yes, they designed it very intentionally to be a healing environment, a comforting environment, a place where people want to come. Not a place of fear and dread. Mm-hmm. And it really does capture that.
Yeah, and when someone is going through the cancer journey, anything that the physician or the hospital can do to ease that, because fear is the biggest enemy, right?
It is.
Yeah.
People people don't get the appropriate screenings, they delay treatment. And so it's a very intentional effort to try to lower that anxiety so people feel more comfortable accessing care. And they get better outcomes as a result of that.
All right. Now, we have like 40 seconds left on the program. Believe it or not, it's kind of flown by. So tell us a little bit about how folks can get in touch with community. Everybody knows where you are. So is there a website or a phone number or?
Well, I would direct anyone to our website. It's www.communitymed.org. Plethora of information there. Our nurse referral line is on there, which 24/7, anybody out in the community that has any kind of question at all about their health. Do I need to take my child in today? I need to find a physician. That's on our nurse referral line, which is on the website.
Dr. French, thanks so much.
Thank you, Peter.
It's a pleasure meeting you.
It was a pleasure meeting both
you
of you.
bet, and welcome
Thanks.
aboard to Health Talk, and that's going to do it for this edition of Health Talk.